I'm here with Dr. Jeff Jahre, Senior VP and Chief Emeritus of Infectious Disease.
Yes, that's correct.
All right. Wonderful.
It is a pleasure to be here with you and your audience.
Well, thank you for coming out. So let's just get right into it. What has this pandemic been like for you? I mean, as an infectious disease doctor, you've trained for this your entire life, and not to, make light of a serious situation, but this is kind of like your Super Bowl, would it not?
Yes, and there's obviously a mixed effect whenever you're facing something like this. So there's a certain sense of exhilaration because this is what we're meant to do. This is what we are doing. And we really feel, particularly being involved with the St. Luke's University Health Network, that we're not only doing it for our community in an outstanding fashion, but we've become a national leader and a reference point. And that may even be true internationally. We get a lot of different comments, and we've been on a number of different national programs because of our leadership and the way that we've handled the pandemic. So that's the good side. The unfortunate side, though, is that there's also a mixture of frustration because we all know that things could be better. And some of those things are within our control, and of course, some of them are not. The pandemic has had many different faces, and unfortunately, it has had a lot of different twists and turns. And we've been very, very out front whenever we give an interview on the pandemic that the information that we're giving is applicable to that day and the way we interpret the scientific evidence. However, we also know that we can be wrong. And that's one of the problems that we have sometimes seen with certain other governmental agencies that are loath to admit when they've made a mistake. We obviously have made mistakes, and the pandemic has surprised us. And when we do that, when we see that, we are very willing to be out front and say, we're going to change. And the reason why we're changing is because the pandemic evidence has made us change. So I think there's a certain sense of humbleness that has to obviously be part of this. And the other part of the frustration is that we do know that vaccination works. We could be far, far better if we had a much better acceptance of vaccination and if it didn't become such a politically polarized situation. And here we're not talking about any one side of the aisle. It really has been throughout, no matter what government agency you're looking at, no matter what administration. Unfortunately, it hasn't been handled very, very well. And then lastly, there's also, unfortunately, a sense of wariness and fatigue. We're now into the second year of this pandemic, and as of March, it will be the second year that we have specifically been involved in it. It hit our country in January, but it wasn't really evident in our area until March. 2 years is a very long time to face this, particularly when we know that this could go on for somewhat longer. And we're seeing an attrition because of that. We have wonderful, dedicated employees. And here I really want to give a shout out to not only our doctors and nurses who have been absolutely outstanding in the way that they've been handling this, but there are so many others who are working in areas where they're not seen. They're not visible, but they're absolutely essential. We can't do what we're doing if we didn't have IT support. We can't do what we're doing if we didn't have environmental services who clean the rooms or food services that manage to give meals to our patients, and all of the people who labor in offices and get us data and do all of the things that are necessary to get through this. And there are so many different areas that I'd be afraid to not mention them. So, we can talk about security. We can talk about all of the technicians and the aides and pharmacy, et cetera, et cetera. This is truly a team sport. And anyone who thinks it isn't is really mistaken. I may have the microphone, but I work and labor with a team that is extraordinarily important and that makes it much easier to do what we do and to do it well.
No, I totally agree. Huge thanks to all of our healthcare workers. But you had touched a little bit about changing information. Do you think that has kind of hurt credibility in the scientific and medical community? Like, for example, when this all first started, I remember the CDC was adamantly against masks, and then all of a sudden they kind of switched their position. Has that been challenging for you? I would imagine it would be.
It's very challenging, and of course, whenever we criticize governmental agencies, there's a lot of criticism of us on how dare we do that. But I think it has now become fairly commonplace to be able to say that the CDC hasn't really communicated very well in this situation. And for that matter, neither have other government agencies, whether it's the FDA or other responsible agencies, the departments of health, in getting the information across. And part of that is to not make pronouncements. And when you make a pronouncement, it's very hard to go back on it. And then people say, you see, you said this, and it's obviously different. And it gives credence to people who become vaccine deniers, or for that matter, even pandemic deniers as a whole. So I think this could be handled much better. There are now, I know, efforts to make sure that this is. I want to say that the Center for Disease Control is an extraordinary valuable resource. I've worked with them, I've published with them, I respect them. But that doesn't mean that they were beyond criticism. None of us are beyond criticism, and criticism can be very helpful in helping to gain improvement. So we need to restore their credibility, not only to try and put an end to this pandemic, but we know that there will be others to come. And we need that agency. We need to have public trust in that agency, and hopefully that'll come.
Okay. So talk to me about pandemics in general. How does a pandemic start? I mean, we've all heard the story of a bat, a lab over in China. We've heard the stories of the 1918 Spanish flu that started again, I believe, with a bird. And there's conflicting stories on that one, where I actually just watched a documentary on the Smithsonian Channel not too long ago, and they were saying that it could have potentially started here in the United States with a army cook.
Well, one of the things that there are a lot of lessons. Let me start with that we can learn from prior pandemics. And as many people who know me realize that in addition to majoring in the usual sciences, I had a minor in history. And so history to me has been extraordinarily important. And I truly believe that there are many lessons that will help us. And if we ignore history, that is really going to be a big mistake. So some of the lessons that we've learned from the history of pandemics is, the first thing is not to assign blame. That's so easy to do, to try and find a scapegoat. It's usually inaccurate, and it creates then a whole degree of isolation and an unwillingness to literally come out with the kind of information that we need to be able to share it. As an example, when the 1918 flu was earmarked as Spanish flu, that was totally inaccurate. And we don't know, we certainly have heard that this originated in Wuhan. It's possible. We don't know whether it's a laboratory accident. We don't know what exactly happened, but there's a tremendous unwillingness because of scapegoating to be able to share the kind of information that we need scientifically in order to get to the bottom. So one of the things is, don't do that. The best thing is to say, look, we're beyond trying to figure out who's to blame. What we really need to do is to figure out how it started so that we can fix it, right, and that we can prevent another one. The second thing that we do learn from prior pandemics is that they don't end because of herd immunity. There is this whole thing that pandemics almost always end because of herd immunity. Actually, it turns out when you look at most pandemics since the dawn of vaccination, vaccination is really what made the difference. And we can go back to the Revolutionary War and smallpox. So vaccination has a huge role to play in helping to end the pandemic. Thirdly, yes, there is kind of a natural life of pandemics that doesn't usually exceed 3 years. So if you, and it can be much shorter if proper steps are taken. So if you want to look at this in a worst case scenario, and if it follows the other lessons from history, it's possible that we might have another year to face where this might still be a major, major issue, and then it may totally go away. It may recede to a point where it's quite handleable, and that remains to be seen. In other words, where it becomes endemic, but at a very low level, like the flu, and that would be a perfect example. In addition, we also know that lessons that have been achieved from prior epidemics, and that means that when it's appropriate, quarantine, certainly social distancing, hand hygiene, and the wearing of proper masks. All of these things have been shown to be tried and true for hundreds of years, not just 50 years, but literally hundreds of years. And when we see that people are denying these lessons of history, we know that that's a huge, huge error. So by looking at all of this, I think we can take some solace in the fact that we have some information. We certainly don't have it all. Hopefully, as time will evolve, we'll get a lot more information. And it's not really to throw criticism on the progress that's been made. Remember that we've just said that we haven't even faced this for a full 2 years in our area. Look at what's happened in that time. That we've developed a vaccine that we know is highly effective in preventing the worst consequences of disease, not necessarily preventing you from getting infected. As we all know, we're seeing tremendous amount of breakthrough infections right now. But it still turns out in our hospital that more than 80% of our cases are unvaccinated. That says something. That's not a government statistic. That's our statistic. It's there for anyone who wants to see it.
Sure.
And when you take a look at people who are actually doing much worse, who are in an ICU or tragically die of this, the numbers are far in excess of 90% that are unvaccinated. So is the vaccine perfect? No, it is not. Is it highly valuable and effective in doing what it was meant to do, which is really to prevent the worst consequences of the disease? I think that's unarguable. The statistics actually show that.
Okay. And talk about pandemics in general. How does a pandemic start, and why don't we see more of them? We had the Spanish flu in 1918, and then basically fast forward 100 years, now you've got COVID-19. Why don't we see more pandemics to my estimation, COVID popped up really, really fast, and it's kind of scary to think that this could almost potentially happen again.
Well, one of the things that was an advantage in the past was that we didn't have the kind of travel that we are now seeing, that you literally could be in any part of the world from any other within less than 12 hours. And with supersonic jets coming, it'd probably be even less. So in the past, pandemics were much more isolated situations, and it took a lot longer for it to actually spread. That's no longer the case. So I think if your point is that we're likely to be seeing other pandemics, I would say that's a guarantee. And we are learning lessons about them, and certainly the lessons that we've learned that we've already alluded to in terms of this pandemic, including the development of vaccines, will help us to be able to staunch future pandemics. So if you want to use the platforms that exist in terms of, let's say, mRNA vaccines, we know that that can be relatively quickly adjusted for other kinds of diseases. And that's what's being worked on as we speak. So there will be, in all likelihood, an mRNA vaccine that will be much more effective against influenza, as an example. And we've obviously certainly improved our distribution networks. And we know that we have things to do in terms of communication. So no matter come what may, I'm confident that we'll be in a better position. But that doesn't mean that we can ever be complacent, because there is a certain evolutionary thrust that our microorganisms are going to try and survive, and our fight against them is going to be ongoing and constant.
Is there a specific catalyst that kind of starts a pandemic? Like, take COVID and Spanish flu. I know I keep going back to those two, but Spanish flu, I believe, was some type of a waterfowl, and then COVID was a bat?
Well, we don't know
Okay.
in terms of certainly in terms of COVID. That's a subject of a lot of investigation and criticism, and we do know that many of these similar viruses are harbored in bats, but whether that was truly where this arose, I think that's still a question that's out there. So, again, pandemics and microorganisms and their ability to be able to infect large numbers of people can arise from a number of different areas. again, it's a certain evolutionary type of concept that they will continue to try and do what they need to do in order to survive. And in order to do that, they have to find appropriate hosts. And in many cases, we are that host.
I see. Lovely. All right. Let's compare COVID to the Spanish flu a little bit more. Like I said, I was recently watching a documentary on the Smithsonian Channel, and it was interesting the correlation between the two, especially the whole like disinformation part and people not trusting things. Now, I think it was a little bit slower because nowadays you've got social media, so you've got this instantaneous questions arise where it took a lot longer for people to question it back in 1918. However, the statistics are kind of close.
Yeah, well, it's a little bit disconcerting when you think of that social media platforms at any given time can reach 1/3 of the world's population. So that can be good if you're putting out the appropriate information on social media, but obviously we've also seen the opposite. So, and sometimes contrary opinions and things that are what I would say would be overly dramatic, that's what sells, and that's what then gets transferred very easily. So we've seen both an advantage and a disadvantage. But one of the things that we certainly found out regarding the 1918 flu pandemic was that cities that did the right thing, and some of them did, Philadelphia was not one of them, by the way, in that kind of situation, but some of them very early on realized that this is something that's rapidly spreading. We can't ignore it. We don't want to have large gatherings. We want to cancel those kind of gatherings. We want to try and encourage the population to wear masks. We want to try and get some kind of conformity with the people that are out there to get them to agree to do the things that we know might help, and that would include social distancing. And so it is very well documented how some cities did a terrific job in this and therefore had much less in the way of their population being affected or unfortunately dying. And other cities that chose to kind of be more laissez-faire about this, they had consequences that were far, far more severe. So have we seen that now? Yes, we have. We've seen that in populations that have done the right thing, that there's less disease overall. And in populations that haven't, there's more disease. The other thing that was very important that came out of the Spanish flu, and is coming out here too, is that there's always this idea that the young, since they're bulletproof, they can handle almost everything. And while it's certainly true that as a whole, with many diseases, younger people, because of a more vigorous immune system, less underlying disease, do better. There was absolutely no question that when you looked at the 19 flu pandemic, that younger people were severely affected, perhaps more so than an older population. And now we're beginning to see that come to pass to some degree, even with the current Omicron virus, that we know that the populations that are coming into a hospital are by and large younger, and we're seeing an influx of children in many cases who have not been vaccinated. So I think to talk about populations because of age that are totally spared, that might be too simplistic.
Understood. So let's talk about viruses in general. How do they mutate, and why do they mutate?
Again, viruses mutate on several different levels, but I think we've already talked about somewhat of the why. Viruses continuously mutate. So Omicron is not the only variant right now that's out there. There's literally hundreds, if not thousands, of variants that currently can be cataloged. Some of them are more robust than others, and those are the ones that are more geared to survival. But we constantly change also. So again, this is, there is a strong pull towards evolution and the ability to survive, and viruses certainly do that.
Is the Omicron variant potentially a good thing, given how contagious it is? I know we kind of touched on this, but to potentially put an end to all of this?
Well, there may be somewhat of a silver lining in this, in that it is certainly more transmissible. That there's no doubt. And by and large, and I would really put that in quotations or in general, it is less fulminant. But, and that's where the big but comes in, for people to think that you're better off getting this, and that's the best way to try and achieve a victory over this, that is really not the right way to do this. And I can only say that, that's often been said about children, that, they're much better off getting it, they're going to do much better with it. Well, try telling that to over 1,000 parents right now who have lost their children to this disease, or the 29,000 children plus that have been hospitalized, and we don't know what the long-term consequences are likely to be. So remember that although there may be some generalities that on the whole might be good, there are so many exceptions, and that's not, the prevention is always much better than cure. And that's the message, really, if we had to get through anything to people, and we've been saying that over and over again. This is not the kind of thing that you want to have a chickenpox party. That was never a good thing to do, because people can and did die of chickenpox. I've seen that myself. And so you're far better off using preventative tools that we know work. And vaccination in both of those circumstances, whether it's chickenpox or for COVID, actually do that.
What does the future of COVID-19 look like if you had to speculate based on the latest information and trends?
So one of the things that I've said over and over again is that I may be many things, but I'm not a prophet. And if I am a prophet, I'm a failed prophet. So I think you have to be able to actually approach this with humbleness. That doesn't mean I don't have an opinion, but as with everyone's opinion, it's subject to criticism and can certainly be wrong. So as an opinion that's based on some historical facts, and I've already alluded to that when we look at pandemics as a whole, they don't usually go beyond 3 years. So I'm hoping that this won't be an exception. And it's a hope and a prayer, but it's not totally without some credence.
All right. Well, let's talk about, and I'm sure you've talked about this at length, vaccines. Specifically, hesitancy in the booster. I think in my opinion, at this point, the vaccines have been available. Either you got it at this point or you're not going to. But some folks who have originally gotten the first 2 shots are still hesitant about the booster. So can you tell me why someone should get a booster if they're already vaccinated and they already had COVID?
Okay, so there's not absolute clear-cut agreement on all of this, but I can certainly tell you what I think is a reasonable posture on this. And one of the issues is the difference in the kind of advice that's come out. Again, whether it's from the CDC or whether it's from the National Institute of Health on this, that there was some evidence that people came out with from governmental agencies back in the spring that, look, if you got your 2 shots of an mRNA vaccine, you can go on and live life as usual. We always felt that was really inappropriate at that point in time. And the reason was that Delta virus was already out there, and we knew that it was making a major impact in countries in Europe like the United Kingdom, and that it was already beginning to be over here. So I think that kind of simplistic approach failed. And then when they try to reverse themselves, people said, see, you don't really know what you're talking about. So again, flexibility is key over here. There are certain basic facts about boosters. First of all, do they work the same for everybody? No, they don't. And the same is true with getting the initial vaccination. So the evidence right now where booster shots is the strongest is for an older population. And here you're really talking about people who are over the age of 70. Okay. That's where you actually have very good evidence. And as well for people who have major underlying diseases and problems with their immune response. So if you have a defect in your immunity, if you have major underlying diseases, then I think there's pretty good evidence that a booster shot is really going to make a difference in you. So where does that leave everybody else? The younger population that says, well, you see, then why should I get a booster? And here you have to think about how you are affecting those that are around you. So in my own opinion, it's much more important if you're going to be living with your grandparents or for instance, or your parents, if they have immune diseases or they have other major health problems, because although you might do very well, even with the 2 shots, if you get COVID, the fact of the matter is you're much more likely to be transmissible for a further duration, and that can obviously affect those around you. So I think you have to take all of these things into account, and that's what we've also talked about with children. So there are certainly exceptions to what we've said, and not every young adult is brisk and healthy. If you have some major underlying health problems, then what I've just said doesn't necessarily apply to you. If you live with people or come in constant contact with people who have major health issues, and healthcare workers are in that category, by the way, for obvious reasons, then a booster shot is not just to help you, but it's more as a societal preference so that what you do doesn't have an adverse effect on those who are very vulnerable around you. And I think you have to make those decisions. And we do have places where you can get that kind of information. In most cases, look at sites that are very reliable. We have our own St. Luke's University health site that gives you some answers to this. And by all means, if you want to know about your own vulnerabilities or for those around you in a very specific manner, talk to your primary care physician.
Okay. Here's the big one. Vaccines in kids. As a dad, when the vaccines first rolled out and it was my turn to get my shot, I didn't even think twice about it because I wanted to help my fellow man and I wanted to help end this thing. But as the vaccines became available to children, I have a 7-year-old and a 10-year-old, I found myself having hesitancy toward this. And it's simply because I know as an adult, I'm fully developed. Whatever happens to me, happens to me. For them, they're still developing, so I don't know if that's going to affect them in any way, shape, or form. They did get the shot, by the way. But like I said, I had this hesitancy, and just in the back of my mind, I was kind of thinking like, man, I'm making this decision for them, which also, as a moral obligation, makes you think twice before you put a shot in your child's arm. Now, granted, I didn't think twice when we gave them every other shot under the sun to have them go to school, but this is a little bit different because it's new. So can you tell me why it's safe for kids to get the vaccine?
All right. Well, first of all, you're not alone. Parental responsibility is a major burden for people, and you do make these decisions for children that you put beyond you, and you want to make sure that those decisions are correct. So I certainly understand why one would want to be more investigative and also ask the appropriate questions. So one of the things, again, that I would say in that kind of regard is that we do have advice that comes from the American Academy of Pediatrics. You can certainly look at their website, and they'll give you some of the fors and againsts. But generally, obviously, it's a for. And I would also speak to your primary care physician, whether that's a pediatrician or a family physician who's taking care of your child, and they can give you some very specific advice. Remember that whenever we do anything, we always try and look at the benefits versus the hazards. So what you have to do in a situation like that is to say, all right, do we absolutely know everything about vaccines? And people always bring this up. You don't have a long-term outlook. Very true. But we also know, again, I can invoke history over here, that the worst adverse effects of vaccines almost always come out within the first couple of months after their release. So we're beyond that right now. And we have found out things, that isn't always favorable. We know that many people do have reactions to those vaccines. And in some cases, those reactions can really put you down for a while.
Sure.
But on the other hand, when you look at the benefit, what about getting COVID? And we've already talked about the consequences in an unvaccinated individual, winding up in a hospital, possibly dying. And then, if that wasn't enough, we also have the so-called long haul type of situation, which can and does occur in children, so that you can have a very minor effect of having COVID in yourself, but still have these long haul symptoms that can be very disabling. And we don't know totally what that's going to do over the long term either. So you have to put that in your kind of computer when you make a decision for your child. So by and large, again, as you know, the vaccine is approved for children who are 5 and up. Certain of those vaccines are. Ages 2 to 5 probably won't be for, my guesstimate would be perhaps another 3 to 6 months, because there's a lot of extra work that's going into it. Not because of safety so much, but to try and find out what the lowest effective dose might be that would still give a good response. So there's more to come on that, and obviously we can talk about that once it does get a release, and I'm pretty confident that it will. But for now, I think your best bet is to be inquisitive. By all means, do that. Get a list of questions, talk about it with your primary care doctor, look at appropriate websites, and then I think it'll help you come to the kind of conclusion that you need in order to feel confident.
Excellent. Right along with that, pregnancy and vaccines. Have there been clinical studies done on pregnant women?
Absolutely.
Okay.
Absolutely. And, again, in the beginning, there was some doubt about this, and I understood the doubt. And we actually gave some deferments early on for people who were pregnant when we asked our healthcare workers to get the vaccine, because we felt that the information wasn't adequate enough to be able to actually push people for sure. That's now been settled. There have been multiple studies that show that COVID in pregnancy is an extraordinarily dangerous disease.
Okay.
And we have seen this. I've seen several tragedies that are just totally unbelievable in pregnant individuals who did not get the vaccine, and the consequences that it not only had for them in a tragic manner, but also for the baby that they were carrying.
Can they pass COVID?
Oh my! Yes.
Wow.
Yeah. I mean, it's just in a way that really there can be premature births. There are all kinds of issues that can happen that are not good. So don't take my word for it. Look at the Academy of Obstetrics and Gynecology has put out a whole thing on this. The group of people that handles maternal child health has also done that. Some of the subspecialists. There's universal agreement right now that not only is it a good thing, but it actually should be done in order to avoid the kind of consequences that we've just been talking about. That COVID and pregnancy is a dangerous combination.
Well, it certainly sounds like it. Do you think the pandemic has helped the medical system? Like, are we better off now knowing what we know, or are we worse than when we started?
Knowledge is very powerful. And, this can be applied to many, many other things. I mean, there are so many things that I learned initially when I was in medical school that have changed and should. And so whatever state of our knowledge is right now, we know that tomorrow it'll be better and the day after that it'll be better. The issue is if we don't heed that kind of information and we deny it, then we're in trouble. And there should be debate. The science has always come about in the proper way because of appropriate debate, and eventually these things get settled with true evidence-based characteristics. And we are in that situation right now with COVID. So if you're saying, are we far better off than we were 2 years ago? There's no question that we are. Are we in a better situation, I hope, to face our next pandemic? Yes. The other thing that we have to keep in mind, and this is applied to the military, of which I used to study military history, and it was always a criticism that your military was always preparing to fight the last war, and there is some truth to that, and there's also some truth when we talk about pandemics. But we also, if anything, that we've learned is that the next pandemic is likely to be very different. It may have some characteristics that are the same, and so that we have to take the kind of lessons that we know can be flexed to a future different kind of pandemic. And I know that we've learned some of those lessons. So it's not 100%, but I have to believe that we're going to be better off for the next one than we have been for this one.
And while we're on the same lines of lessons learned, what lessons did St. Luke's learn specifically from this COVID-19 pandemic?
So the reason why we have become the leader that we are, not only regionally but nationally, and actually it's also been acknowledged internationally, is because of many of the things that have been done that have to do with culture. So very early on, we decided to organize ourselves into 26 different groups that would get together on a frequent basis and that would not duplicate each other's efforts or get in each other's way. We would be there to share information. We would be there to help each other, but we wouldn't be there to stifle each other and to duplicate those efforts. That turned out to be an immensely powerful thing. You have to avoid a real bureaucracy where everything has to be approved in every step up the line. If you do that and you're facing an emergency, you're never going to be on time, and what you're going to end up doing is always taking what is considered to be the non-controversial or safe route, and that doesn't apply when you're dealing with an emergency. You have to be able to work quickly, not do anything rash, but to be able to take everybody's input and use that. So I can give you some very, very specific examples right from the very beginning. From the very beginning, we knew that we were going to have an increased supply of personal protective equipment, or so-called PPE. As you know, there was a tremendous national shortage with that. So we didn't wait around for the government to save us in that kind of situation. We already knew that when some of the supplies that were put into effect from some of the governmental agencies, they were found to be totally inadequate. They had expired. The elastic bands, had rotted away. I can't tell you how bad the situation really was. It was virtually useless. So hopefully the government has learned something about that too. But what we ended up doing very quickly is to be able to develop our own supply chain and with reusables in a way. So we had some very, very clever people who developed a sterilization system that was patented.
The sunlight thing, right?
It had ultraviolet light that we knew would not damage the equipment, and we could use it for a certain period of time. That would be very effective, and we were doing that so that we would have very good reuse of the appropriate equipment. We also were the first, if you can believe this right now, to use 3D printing in making our own personal protective equipment. We got written up in the Wall Street Journal. Right now it's just considered, hey, so what? Everybody does that. Well, everybody does it now.
Sure.
But St. Luke's was the first internationally to do that. In addition, we also became a major use because we obviously had to do communication in a very quick way and not try and get everybody together in one place. And so we became the international, and I want to stress that, the international example for the use of Teams. That's Microsoft.
Oh, yeah.
So if you watched the Super Bowl 2 years ago, they showed how Teams was being used by universities. They were showing how it was being used by industry. And guess what? They showed how it was being used in healthcare. And who did they use?
St. Luke's.
St. Luke's. That was some of the examples very, very early on. In addition, we started to put things in place in terms of treatment. So we knew very quickly, and we were criticized initially for not trying to put people on ventilators. Some of the big universities, and we just said, that's ridiculous. We have learned that's not the thing to do. Mm-hmm. And sure enough, as you know, right now, that's accepted norm. And we did that right from the beginning. So if you wanted to look at our mortality rates, they were literally 1/4 of those of many other regional hospitals, much less national or international. And so we were in the top decile right from the beginning. And obviously the use of other modalities like steroids, proning, et cetera, all of that, we were very early adapters, if not the earliest adapter to be using those. And we did not have to get this kind of bureaucratic approval. And I do credit that to our CEO, who is, for a good reason, the longest serving CEO in the country, because he has always said, Don't be afraid to do things. And just, we have to keep communication, but I don't need to be able to approve every little thing that everybody is doing. And so we took a lot of information. Even some of our smaller hospitals, we found they were developing methods of isolation, keeping the rooms in what we call negative pressure, that were really very innovative for that type of facility that we were able to then use for all of our other facilities. So it isn't a thought process that just because you're at a larger hospital that you have a larger brain. That is not the case whatsoever. And so we were a very, very big tent in that situation, and it has served us well. I can also then go through some things that are even more recent. If you remember that when our gyms, our fitness centers, we came out with requiring everybody who goes to those fitness centers, this was done last spring, to have a vaccine. Well, we got, criticism internationally. You can remember that. It was like we had committed a cardinal sin. We said, something, we're not running a popularity contest over here. We're going to do what's right because we know that this is the best thing for our community. And why are we in existence? We're in existence to be able to give the best kind of health care and advice to our population that we serve and to keep them safe as well as to keep our staff safe. And obviously, as you know right now, that's considered to be almost without question the thing to do in many of those cases. And I could go on to a number of other situations. About 6 or 8 months ago, we started to let our personnel know, look, we think vaccination is important. Because we think it's important, it's particularly important for healthcare workers who deal with the most vulnerable people to be vaccinated so that you don't act as a transmitter and that you keep yourself safe and you also keep our patients safe. Both very, very important things. And so we gave what you would consider to be a very long runway of information. We started to give them that information early on. We provided many different places for them to ask questions. We also gave incentivization for them to get the vaccine. So by the time we put it into effect, and we were one of the earliest hospitals in the country, certainly in the region, to put it totally into effect without question. We didn't wait for an EUA to be lifted or a lot of other nonsense. We just said, again, we're not running a popularity contest. We're doing what we know is right. So on September the 25th, that was our break-off date. And that was well before any government mandate. And at that point, we already had 90% of our employees who had agreed to get the vaccine. So we just had to work on the other 10%, and some of them did get exemptions because they should. And so we were not ignorant in terms of trying to have some flexibility for people who did have a legitimate reason for exemption, but it wasn't a very, very large number. And because of that, we ended up early on having the kind of response that we needed in having a vaccinated staff that has helped us throughout and has kept them safe, has kept our patients safe.
So I think you hit the nail right on the head, where being a leader isn't always necessarily the most popular choice, but it is the right thing to do. Yeah,
and there are other hospitals and networks that have never even put a mandate into effect, or they put it in a very lukewarm fashion. They're worried about market share. They're worried about popularity. The reason why we're not worried about that is that we know that if we do the right thing, eventually all of those other good things will accrue.
Sure.
And no, in any of these things, you're not going to please 100% of the population, but the vast majority of people understand why we're doing this, because we've certainly put that messaging out and are totally go along with us.
When we're talking about innovation, are there any other unpopular choices that St. Luke's has made that you guys have come out smelling like roses in the end?
I certainly believe so. As you know, we were the first to recognize the importance of natural immunity.
Yes.
And that we knew that you had to take that into account when you were giving people advice on whether they should or shouldn't get a certain number of vaccinations. When we came out with that, again, we were highly criticized by a number of even governmental agencies, which still haven't totally come around to accepting this, but certainly most scholars at this point have. So we were the first, and I always say we lead, others follow. And in that situation, we got a lot of national attention. And here I think it's very important to point out that sometimes we're tarred because people are not listening to our message, but they're listening to where the message is coming from. Our message is consistent. It's always the same. Whether we're being interviewed by very conservative radio networks, and we certainly have, or whether we're being interviewed by very liberal networks or newspapers, and we certainly have as well. So what I would let people know is please pay attention to our message, and that it isn't necessarily, and it doesn't always jive with what the overall opinion of the interviewer is or that station, but the message is the same. We're not tailoring that to be popular. And I think that's given us a lot of credit. And I can't tell you how much national attention we get all the time, including, as of yesterday, we had a conversation with what's considered to be the most important newspaper in the country. So people are coming to us. They want to know what St. Luke's opinion is because we're out there and it counts. So it served us well.
On a fence.
We are not sitting on a fence.
You're making a decision and you're going with it.
Absolutely.
And I think we've had just about enough COVID talk. I'm sure you're exceptionally tired of talking about it.
Thank you for that.
So now we're going to talk about Jeff Jahre, the man. Okay. I heard that you are quite the equestrian enthusiast. Is that correct?
Well, I am, and it does run in my family. My wife obviously had horses when she was much younger and lived in a more rural area. And one of the advantages of living in this area is that we were able to have a return to horses. I lived out west for a while and got acquainted with horses and horsemanship, and so it's been a very good exercise for us. And I've always said that we've learned a lot more from horses than horses learn from us.
But you have a horse named after you, correct?
I do. And
how did that happen?
Well, that has to do with a wonderful individual by the name of Mike Caruso.
Okay.
And Mike is an extraordinary individual who's been well known in the Lehigh Valley. He was a top wrestler for Lehigh
yep.
and had a very successful firm that he ran for many years and got himself interested in raising horses that were going to race, and he's done very, very well with his partners. And a number of these horses have really gotten major national attention. So one of the major benefits that I've had is to have the friendship of Mike Caruso. And that's far more valuable than anything that has to do with horses. But he very kindly named one of his up-and-coming horses after me, and it was Dr. Jeff. And luckily, the horse has done pretty well.
Oh, that's quite the honor, for sure. Oh, that's amazing.
But the honor for me is actually knowing and being a friend of Mike Caruso.
So sticking with horses, I also heard that you're involved with the Bethlehem Mounted Police?
Yes. So I have a number of friends who are either currently active in the police departments or retired. And a number of them actually I've gotten to know through our acquaintance and commonalities with horses. So one of the things that became pretty evident early on is that many of the police departments disbanded their equine units. As you may know, Philadelphia had a very noted one, and then they disbanded it. Bethlehem, many years ago, actually had a horse unit and it was disbanded. They're expensive to run. They require a lot of upkeep. They require a lot of training. And I think that from a budgetary situation, oftentimes there's not a realization of what these animal partnerships with a talented policeman who's an equestrian can do for the community. So we realized early that there were some real benefits to be accrued by having an active equine unit be reinstituted or reconstituted within Bethlehem. And some of those things are that they are wonderful community ambassadors. That the police have always tried to feel like they need to be closer, if they should, to the community that they serve.
I will say they are amazing with the kids.
And that is extraordinarily important, so that these animals, they're not just, they don't just arrive on site. They require an inordinate amount of training. They need to have a certain temperament. Horses are flight animals, and so they can move very quickly, and usually they try and run away from anything that scares them. So the whole idea is to gently get them acquainted with any of the things that they're likely to face so that they don't suddenly bolt or do something that can really create a dangerous situation. And these horses have all of that. Plus, obviously, they have trained riders who know what the kind of responses are likely to be and can anticipate some of this. So when they're with children, there's nothing that's really as heartwarming as to see them go out in the community, have them get close to the population they're serving, have kids come over and pet the horses. Horses love it, and the kids love it.
My kids love it, and it's amazing to me because not only are the horses cool, but the officers that ride them are super nice to the kids.
They are community ambassadors in every way.
Yeah.
And the other things that I think are very important for the community to realize is that they have unique attributes. For instance, crowd control. We are a major tourist destination where we get large crowds. Mm-hmm. And so when you have an officer on a horse and the horse is acting appropriately, it can gently make sure that the crowd is kept within certain boundaries. And, they've been used in Music Fest and other areas like that. They can be used in certain search and rescue type of situations where it's not easy to get into certain areas, in a vehicle or even on foot. So they're very, very versatile. And I think the other important thing for the community to know is that this is really self-supported. So they have a terrific facility by the money that they've raised, and they're always doing things that we're happy to be a part of to help them get the funds that they need so that they can continue. And it isn't a burden on the community. It is a very, very big asset.
Excellent. So more stuff about you. I heard that you're also a history buff, and you're big into Civil War medicine?
Yes. So military history has always fascinated me for a number of reasons. Again, I think you can get a lot of lessons from history, as we pointed out when we talked about pandemics. And there are certain things about the Civil War, specifically as it has to do with medicine and infectious disease, that people don't realize. First of all, I think it's well known that it's been America's bloodiest conflict, that for all practical purposes, there were more people that died in the Civil War than virtually all of our other wars combined. Wow. And when you look at the numbers of individuals that were affected, 1 out of every 4 soldiers that didn't come back. And when you try and look at the percentage of the population that was, which was much higher than it would be now because the population was smaller, it affected every family in a major way. And what is not realized is, of all of the fatalities, 2/3 of the people that died in the Civil War did not die on the battlefield. They died from disease. And the major part of that component were infections. Diseases like measles, diarrhea, dehydration, these, due to food poisoning or other things, took a tremendous toll on the soldiers. And then even if you take a look at the 1/3 of the individuals that died on the battlefield, many of those people actually died of wounds that became infected. So when you look at the component that had to do with infections, it's enormous. And so anyone who's obviously in infectious diseases, who studies history, would have to be able to look at that in a way that is very pronounced and interesting.
Do you think it's because of what we knew back then? Like, I heard doctors used to just not even wash their hands because they just figured they were going to get them dirty anyway.
All right. So I think one of the things, if you talk to true historians, you have to be very careful about something that's known as presentism. And that is trying to judge what went on in the past through the lens of what you now know.
Okay.
And there's a tendency to say, oh, look how ignorant those people were because they didn't do this and they didn't do that. And actually, that's not true. And the people then were every bit as intelligent as people now. but that we've learned certain lessons that they didn't have at that point in time. So they had to do certain things that were not wouldn't be acknowledged today. And I can give you an example. This is what's going to happen in the future. I can see, and I often bring this out when I lecture on the Civil War, people at some point in time are going to say, look at the way these folks treat cancer, where they're using agents that literally can poison the entire body to get at specific cells. Or they make these huge incisions in order to be able to get at a certain site or an organ, when now we can do it with either non-invasive approaches or minimal incision surgery. Some of that we're already seeing. Or, look at some of the drugs that we're using right now that we find that really have, in many cases, many side effects that could be avoided in future drugs. So be very, very careful about trying to ascribe the knowledge that we have today and in a way that makes people sound like they were ignorant in the past. These individuals did the best they could under the circumstances for the knowledge that they had. And of course, the whole idea of the germ theory, and it really didn't come about until far later in sterilization. So it wasn't really until the early 1870s that we began to have much more of a realization. So what they did accomplish, though, was extraordinary when you think about the tools that they had and the knowledge that they had at the time. And so a lot of the amputations that were done because there were no antibiotics. And that if one developed an infection, it would literally go through the entire body and kill that individual. And so they took a course that they felt was necessary, and it wasn't done in a way that is as brutal as it may seem to us right now. Anesthesia actually did exist during that time, as an example. And again, they did what they needed to do under the circumstances.
That was the move to do at the time to keep that person alive.
It was.
Okay, that makes sense. How has medicine evolved since that era?
Well, of course, we continually evolve. I mean, look at all the things that we've learned, as we mentioned, about the pandemic in the last 2 years, or, I can name a number of things that I did that was considered to be state of the art when I first got out of medical school. I mean, we were using aspirin, as a common agent at that point in time to reduce people's fevers and even people that were going for surgery. The anticoagulant effect of aspirin, even though it had been around for many, many years, wasn't well known. One of the more common admissions to a hospital at that time was known as digoxin or digitoxicity, because people were getting digitalis type compounds for all types of heart failure. And we found that only later on that in many cases, not all, obviously, it was doing more harm than good. So clearly, I'm just giving you some examples that were contemporary just in my time. And there's no question that, we'll all be a lot smarter tomorrow than we are today, and hopefully be much smarter the day after tomorrow than we will be tomorrow. And that's the way medicine evolves and should evolve.
Are there any other specific things that doctors believed back then that we know better now?
When we're talking about the Civil War,
sure.
Yeah. Well, again, I think that because not having really true knowledge of microorganisms, even though they knew that microorganisms existed, they felt that anything that was really that small wouldn't hurt you. And there was a belief in what's known as miasmas, that a lot of diseases were caused by noxious substances that came out of the ground, as an example. So there was also during the Civil War, there were a number of advances that were made. For instance, in terms of sanitation, that the sanitation in many of these camps was just literally abhorrent, and that oftentimes the drinking water was fouled, that people were drinking water and from a downstream from where people were literally using the water as a bathroom, or that in many cases some of the animals did. So that was actually cleaned up to a large extent during the war. It was the precursor of what we now consider the public health service. And it was started really as a civilian service that said, look, this is really untenable and we can do much better. And so there were certain standards on how to have latrines and where drinking water should be obtained, and also how some of the food should be kept. And that was actually developed during the war, as well as triage, because that was an extremely important thing, and we use that today, you
Sure.
know, in a major situation, that you have to be able to look at people and decide when you have mass casualty events who actually needs the treatment as a priority. It's not necessarily who gets to your door first. And that was all really developed to a very, very large extent during the Civil War. A professional nursing corps, was also an outset. In the beginning, it really didn't exist at all. And by the end of the Civil War, then I think there was certainly major inroads that were made to having a professional nursing corps and not just allowing it to just happen, which is what oftentimes it did. Having better means of evacuation and ambulances. All of these things, there was an unbelievable spurt of knowledge that the Civil War started.
History just fascinates me, and I think it's so crucial to our development as we move forward. But all right, so now we'll move on to the rapid fire question section of our show. We've done this with a couple of our other guests, so I'm just going to throw out a couple of quick questions for you.
Well, I hope I'm up to the task.
I'm sure you will be. As a history buff, what's your favorite pandemic?
I don't have a favorite pandemic. It has to be the one that we're dealing with right now, because obviously that's the one that has all my attention.
Sure.
So I can say I don't want to use the word favorite, because that puts a gloss on what really is a tragedy.
Yes.
But it certainly is the one really that has occupied us and should occupy us for now.
Okay. Do you follow any sports?
I do.
What's your favorite team?
Well, I follow skiing as an example,
Okay.
Because we were involved in that at one point in time.
Okay.
And it's also very interesting to see how the United States is doing in that situation. And I'll follow football when the teams that I'm rooting for are winning. And that isn't often the case.
And who is that?
Well, at one point it was the New York Giants, and obviously
Okay.
you can't
Yeah.
live here and be a New York Giants fan. You have to be a Philadelphia Eagles fan.
Plus,
they both have let me down recently.
They had a couple of rough years there for sure.
Yes.
Favorite travel destination?
So I, at one point, was very active in terms of scuba diving because I found just from a view of nature, it was for me almost as close to heaven if you had unlimited visibility, and there were certain areas of the world that you could travel in, and if the weather was right and everything was right, you could have greater than 100 or 150 foot visibility. It was almost like being in a fairyland. So certainly that has to rank up there. There are major risks, unfortunately, with scuba diving, and those risks do go up as you get older, so that has to be taken into account. Right now, I think snorkeling would be much more probably in terms
safer.
of a compatibility with my age.
Gotcha.
Yes.
Gotcha. All right. Where's your favorite snorkeling spot?
So, there were certainly areas in the Caribbean that I truly enjoyed. One of them was off of an island known as Bonaire, which was part of, it was a Dutch-controlled and still is island, and also some of the areas off of Belize.
Oh, okay. I heard that's very pretty there.
It is, and we were very fortunate to be there at times when we had perfect weather and could see things that normally people didn't encounter.
Has your profession taken you anywhere throughout the world because of the fact that you're an infectious disease doctor?
No, not specifically, because I try when I go on vacation to leave that part of it behind. But it's not that I'm totally uninterested in how healthcare is delivered around the world. And that, I think, is an extremely important point also to make, that people in this country just don't realize, even though there's plenty of criticism that's heaped on the healthcare industry, and I understand the reasons for that, and a lot of it is valid, but there is really no other place in the world that can give you the kind of breadth and depth of appropriate healthcare that you can find in this country. So that's something that I really have come to see firsthand in many of the other areas that I visit around the world.
I tell people that all the time, like if they're complaining about any type of healthcare situation, even insurance, and I say, do yourself a favor, take a trip to a third world country and see what's going on down there or wherever.
Or a lot of countries where there's much more of a socialist agenda, and you find that although it has certain advantages that one can't deny, there are many, many, many disadvantages that are associated with that one-size-fits-all concept.
Sure. Favorite historical era?
Well, I've studied many different historical eras, and one of the things that I have tried to look on is World War II, particularly, partly because of my family background, and trying to understand what led to World War II, what led to a situation that is known as the Holocaust, and how a society that was as advanced as Germany could fall into the kind of trap that it did, to literally fall behind a leader that was, by all accounts, insane. Mm-hmm. And, one can see sometimes signs of that today, and that's why I think there are some warning signs that we have to be aware of. You need a two-party system. Whether you like one party better than the other, I don't care. But you need more than one party out there. And otherwise, whatever party is in power, if it's a total power corrupts, absolute power corrupts. And I think that we constantly have to educate a population of what some of the dangers are of forming opinions based, particularly now in social media. Just think of what would happen if social media was in place during Germany's Nazi rise, and look at the damage that happened without that. And if they had reached 1/3 of the world inside of one day, with tweets or with other things, the kind of catastrophic effect that it would have had beyond what already occurred.
Favorite food?
Oh, I have a large interest in many different foods, which is far beyond when I was a kid. Despite the fact that my mother was a dietitian, I was probably the worst eater in the world. They actually had, at one point, the Board of Health came to visit our family to make sure that I wasn't being abused. I think it was more the opposite, that I was abusing my mother and my choices of food. But I've gotten much better in that. In that. So I really enjoy a wide variety of foods.
Last one, something most people might not know about you.
Oh, I don't know that I'm that much of a public person. I'd like to think that what I'm trying to do is understood by many people, even though sometimes it is opinionated and I can be accused of being hard-headed. I understand that. But that I truly have the best intent in mind. The execution isn't always perfect, but the intent is there. And I want to be able to, I'm at the winter of my career, there's no question about that. And when I do stop, I want to be able to say that I've made a contribution so that I've left things in a better place than what they were. And if I can do that, then I know that I've been successful.
I can personally tell you that you have.
Thank you.
Any final thoughts or a closing message to our listeners?
No, I don't. I've enjoyed speaking with you, and I hope that our audience finds it equally enjoyable.
Well, thank you so much for taking time. I know you are super spread thin right now. Dr. Jeff Jahre, Senior VP and Chief Emeritus of Infectious Disease for St. Luke's University Health Network. Thank you so much for taking the time to visit with us today.
It's been my pleasure.